you to introduce our host and presenter, Dr. Sanjay Kalra, immediate past president of Endocrine Society of India, consultant at Bharti Hospital, Karnal. Over to you, sir.
Thank you, Ankur, and good evening, everybody. Uh, Happy Indian New Year to everyone. This is the day when the sun shifts its orbit and when we mark the beginning of a new year. Today, we'll be speaking about something that is very close to our heart, and I welcome all of us who are gathered here from India and also those who are logged in from other countries of Asia and Africa. This is a series, Diabetes Essentials, where we talk about things that are essential to diabetes practice. But many of you have commented, and rightfully so, that what you're teaching us is theoretical. Of course, we do bring a practical, pragmatic aspect to whatever we say, and we talk about ground reality in India and in other developing countries. But still, a point that many of you have raised is I do not have time. The book says I should spend 30 or 45 minutes per consultation, but I just cannot do that. I see 50, 75, 100, 150 patients a day. How do I justify my consultation? The first thing I would like to say is do not feel guilty. You are doing your best. All of us are doing our best. And of course, our patients have rights. We fully agree. Our patients and we both have a responsibility for good diabetes care. This responsibility is shared. We fully agree. But then rights and responsibility should be tempered by reality. And reality means that the number of healthcare professionals in most countries is just not adequate to handle diabetes care. Does this mean that we do not handle diabetes at all? No, certainly not at all. We must do it. And we will show how we can do it in a meaningful way in 5 minutes. Also, do remember that Rome was not built in a day. And then neither was Mumbai or New Delhi or Mogadishu for that matter. We keep on building, we keep on evolving. When I joined practice, and now I have completed 25 years in endocrinology, when I joined practice 23 years ago, I used to be so confused. Evidence-based medicine used to teach me something, but in practice, things were not working out. Evidence-based medicine is based upon randomized controlled trials. Randomized controlled trials occur in a different ecosystem. But the ecosystem that I found myself in Karnal, which is a small town in Haryana, which is a small state of India, this ecosystem was different. So I used to get confused. How can I manage? How can I justify to myself that I'm doing a good job? I used to think also that I'm doing a fairly good job, but this nagging doubt was always there about evidence-based medicine telling me something and my experience telling me something. And then one fine day, I learned a new word called logical empiricism. Logical empiricism is a school of science. It was very popular up till World War II. What it tells you is that you may be practicing empirically, but whatever you are doing is based on logic. It is based on evidence. So how do you get evidence and experiential learning together? You get it together through logical empiricism. How do you accept and acknowledge the rights of your patient, their family, their caregivers, and yourself, and your own rights also? As a healthcare professional, we also have rights. We have the right to respect. We have the right to be treated humanely. How do we handle these rights with responsibilities? My responsibility, the responsibility of my healthcare team, and also the responsibility of my patient and his or her family caregiver. How do we handle these together? This is by understanding the reality, by understanding the ecosystem that we live in. Also, do not feel guilty if you're giving only 5 minutes, because that is all that you have. It might be 2.5 minutes also. Do remember that when you are working in India or Saudi Arabia or Somalia or Somaliland, do remember that you are so accessible to your patient. At the most, your patient will have to wait in line for 1 hour, 1.5 hours, not more than that. In the West, in the developed countries, you have to get an appointment to meet the diabetologist or the endocrinologist, and that appointment might take 3 months, 6 months. So do not feel guilty if you have to manage things in lesser time. So how do we manage in 5 minutes? let's come to our topic for today. And then you will laugh at me and you will say, sir, the preamble is more than 5 minutes, and now you're expecting us to do a good job in few minutes. So let's do it. The same rules that we follow for acute medicine, what you learned when you were in medical college, those same rules apply to diabetes, which is a chronic disease. So first sentence is greeting. Good morning, sir. Good morning, madam. Welcome, young man. Welcome, son. Welcome, little brother, little daughter, little sister. Whatever is appropriate for your culture, for the patient's age and gender. Create a bond. How can I help you today? What is your main complaint or your main concern? Now, this complaint will, of course, be a symptom, right? But increasingly in the diabetes clinic, you will find that there is no symptom, but there is a concern. The concern may be, sir, look at my reports. The ESR is 42. Sir, the LDL cholesterol is 101. Sir, my glucose control is not good. I don't have any complaints, but my numbers are bad. The concern also might be, sir, I went and got this health checkup done. Just see if the numbers are okay. So identify the main complaint or concern which has brought the patient to you. Suppose there is a symptom or there is a suggestion of poor glucose control. Now you've got that, then you go to the cause. Okay, so madam, your complaint is burning micturition, or your complaint is a wound that is not healing, or maybe pain in your shoulder or in your legs. Let us find out the cause for that. Now, there is something known as fishbone analysis or Ishihara's analysis. So now your chief complaint is frozen shoulder. Let us take, for example, what is the cause of that? The cause of that is poor control of diabetes. What is the cause of that? Are you taking the right medicines? Are you following the right diet or physical activity? Has your diabetes been diagnosed correctly? So we do all this. So we find out the cause of diabetes. Is it type 1, type 2, pancreatic, or secondary? We find out the reason for poor control. Is it something related to lifestyle? Is it something related to medication? And then we see if there is another cause for the complaint. There might be a rotator cuff injury. If there is burning micturition, of course, poor control of diabetes is leading to that, but there will be a UTI. Is it a urinary tract or a genital tract infection? So we look at the history. So let me repeat again. We have to do all this in 5 minutes. First, welcome the patient, create a bond, ensure good communication, find out the chief complaint or concern, address that, find the cause of that. While you are finding the causes, also think of the consequences. What will happen if I do not correct that ESR 42? What will happen if I am not able to fix up the genital tract infection? But why think negatively? Let us think positively. So we tell our patient, yes, madam, I have heard with both ears that you are worried about your pain abdomen, or you are worried about burning feet. We can fix this. It will take the following number of days or weeks to fix. So you do a reality check. Madam, I am going to prescribe these medicines. Within a few days, you will feel better. You will feel happier. It may take a few days, but certainly you will feel better. You will be able to sleep well. Then your postprandial glucose will come down, and fasting glucose may take 10 or 15 days to come down. Because I am giving a basal insulin, it will take time. So you talk about the consequences. Speak in positive terms. Madam, this is what we can do. Okay, now, madam, we may not be able to correct your weight within the next 2 to 4 weeks, but let us take that step later. Let us climb one step at a time. Allow me to focus on this, because like you have said, this symptom, this condition is what is impacting your quality of life. Once I have done this, next week we can focus on the other things. So climb one step at a time. Let us look at it in two ways. What is it that the patient wants? The first thing that the patient wants is symptomatic well-being. Until you give that, patient is not going to be happy. So you tell the patient, I have given you such and such expensive medicine to prevent heart disease, to prevent kidney disease. Patient will laugh at you. And she will say, Doctor, you have not been able to control my polyuria, and you are talking of my kidney control 10 years from now. So the first is symptomatic control. Whatever patient symptom has, patient is correct. So you control the symptoms, whether it is pain, weakness, loss of appetite, increased appetite, whatever it is. Second is glucometabolic control in a hierarchy. So you've given the symptomatic control. Now you say, Madam, your glucose level will also come down. Do not worry. Your HbA1c will also come down. And after that, you focus on cardiovascular safety. So, Madam, the drugs that we are giving you are safe for your heart. They are safe for your kidney, for all your organs. And after that, then you will say, Madam, I am giving you drugs which will help protect your heart and kidney against further damage. Wherever your patient is in this hierarchy, just move one step above. Like Rome was not built in a day, even Mount Everest cannot be climbed in a day. So go one step at a time. Now, so far, we've just done communication. We have identified the main cause or the main concern or complaint. Then we have identified the cause that leads to it. We've also identified maybe concomitant medication, contributory factors, confounding factors which will impact our intervention. So now we move on to intervention and we say, Madam, allow me to offer the following things. Now, it is always a good idea to focus on lifestyle. Madam, do focus on diet, stress, sleep, exercise. By this time, you will have an idea of what is important. You say, Madam, are you sleeping well at night? The answer is no. Okay, now how do you sleep well? If you jump straight to giving a tablet, that is not the sign of a good physician. So, in general, whatever is the main issue for the patient, you give a couple of do's and a couple of don'ts. Let me take some examples. Madam, it is winter time here in North India. You can happily take as much radish or carrot or cucumber as you want. That is a positive thing. Do focus more on colored vegetables, green leafy vegetables. Another positive thing. Do's. Begin with positive and now don't. But madam, please take care that you should not eat too much of ghee or salt. Please avoid fried things. Right? So do's followed by don'ts. Now remember the middle path of Lord Buddha. So madam, please do not take, now I am shifting to Hindi, please do not take gajar ka halwa or carrot halwa. Halwa, whether in Arabic or in Hindi, means something that is cooked in oil or in fat or in ghee, in clarified butter. But you can take gajar ki kheer or carrot kheer, which would be in English maybe a carrot pudding, something that is cooked only in milk without adding ghee or oil. So there are less calories. Do remember that you should not add sugar to it. If you wish, once you have cooked that carrot kheer or carrot pudding, you can add a little bit of sugar-free or non-nutritive sweetener later on. Or you might want to add one date. You can take one good date, break it into 4 pieces, and just put it while the pudding is boiling. So see, do's and don'ts, and now such a happy feeling. And now you've come across as a doctor. I have allowed you, I have encouraged you, I have enabled you to take something sweet, which is carrot pudding. Let's talk about the other example, stress. Madam, I understand that you are stressed out. This is part of life. I can empathize with you. But do you believe in religion? See what the Holy Quran tells us. See what the Bhagavad Gita tells us. See what the Bible tells us. It tells us to relax, to try to achieve a state of equanimity. Trust in God, madam, and I'm sure you'll be fine. Right? Something positive. Somebody is an atheist, so they have a right to be atheist. So then, but because you are working in your community, you are community based, community oriented, these things you already know. So for an atheist would be, why don't we try some yoga or meditation? Or why don't you find a new hobby? You know, one of my patients, he adopted all the street dogs, all the dogs who were roaming around in the street, and now he gives them milk in the morning and at night. He has made 10 different friends. He has got meaning in life. His stress levels have come down after adopting the street dogs. And this is a hi from Blackie, who is my street dog. He has been taking care of our house and our street for the past 10 years now. He's growing old. I'm also growing old, but Blackie is my best friend. So when we meet him, we actually feel de-stressed. Sleep. Like I said, don't jump to the tablet. You may, of course, prescribe a, sleep-inducing tablet. Prefer the non-benzodiazepines. For example, zolpidem or lemborexant. Lemborexant also helps in bringing down fasting glucose. But before that, things like try to switch off your mobile phone an hour or two before going to bed. Do not watch any dangerous or scary or horror movies. Drink a glass of hot milk, add some cinnamon to it, add some turmeric to it, whatever is socially appropriate, and see how that helps you sleep. Exercise. I understand you are not able to go out of the house because maybe it is too cold or it is not safe or it is socially not acceptable. But at home, this is the way in which you can exercise. So, first focus on lifestyle, a couple of do's followed by a few don'ts. Then you come to pharmacology. Madam, this is what I am prescribing for you. This will help you achieve the following endpoints. It will make you happy. It will give you well being. It will control your symptoms. The following symptoms will get controlled in the coming days. These symptoms may take a few weeks to reverse, but we are on the job. Do not worry, madam. I am with you. And then these are the investigations that are necessary. So, this is how you speak. The order should be lifestyle, do's and don'ts, followed by pharmacology, followed by investigations. Now, in 5 minutes, it is difficult to do everything, right? I fully agree. You cannot do justice to the multi-systemic syndrome that diabetes is. So, you share your plan for next visit. Madam, today I have worked on glucose control and your symptom, which was burning micturition. However, we still have to talk to you about, how to cook healthy food. Allow me to do that next time. We still have to give you medicines for cholesterol. We will do that once this acute infection is over. And sir, we have got the HbA1c report, but we did not do the renal function or the hepatic function. So let us do that anytime in the next 1 or 1.5 months. And you do need a fundus examination every year. So whenever you are free from work, whenever you don't have too much of writing work to do, or there is someone else with you who can drive your car or scooter, two-wheeler, then please come for a fundus examination. So share the plan for the next visit so that the patient has something to look forward to. Also note that in almost all our settings, patient has to pay from pocket. So do remember to weigh the prescription. Weigh means not only in terms of the weight of the tablets, the pill burden, the number of tablets, but also in terms of cost. So if you are treating a person for diabetic foot, right, and the patient has got a limb-threatening infection, your focus will be antibiotics. You will give 1, 2, 3 antibiotics, maybe 2 broad-spectrum antibiotics and 1 metronidazole. You may do incision and drainage. Now, at this point of time, the main focus is limb salvage. Patient, why would the patient bother about kidney safety or maybe liver safety or erectile dysfunction if the foot is not okay? So you tell the patient, let me fix up the foot first. Once this is done, once the pill burden comes down, then we will add the other medicines. So now this is important also. Like we said, Rome was not built in a day and Mount Everest was not climbed in a day. Supposing the patient comes to you with pain in the legs, right? This is neuropathy. Giddiness, dizziness. This is also neuropathy. And erectile dysfunction. This is also neuropathy in part. So you ask the patient, what is it which is troubling you the most? Whatever the patient says is troubling me the most, you begin intervening in that first. Not to say that you cannot be simultaneous. Of course, simultaneously, I can give a drug for painful neuropathy. I can also give a drug for erectile dysfunction, and I can give the drug for postural hypotension or for isolated systolic hypertension. But my main prescription will be based upon what my patient wants. As an example, let me share. If the main complaint is painful diabetic neuropathy, then I will give duloxetine or maybe nortriptyline. However, if the main disease is or the main complaint is erectile dysfunction, I will not give either of these because they are going to worsen the erectile dysfunction. Then I will give trazodone, 25 milligram HS, which is an antidepressant, which will help in the erectile dysfunction as well. So that is how you sort of weigh the entire load, and then you are able to prioritize as well. Now, so many things, and again, you will smile at inside yourself, and you will say, "Dr. Sanjay said I will finish everything in 5 minutes, but already he has spent so much time, and the slides are still not over." Uh, I would like to state here that uh, in India, in Africa, we have a double challenge when we manage diabetes. For our colleagues in the West, in developed countries, maybe diabetes is a chronic disease, so they manage it that way. That is their mindset. But we cannot afford this luxury. In my clinic, some patients come with diabetes as a chronic disease. They do not have any acute symptoms, they just have concerns. They come to show their lab values, and they are either asymptomatic or mildly symptomatic. Others come with acute full blown disease, with a diabetic foot, with gangrene, with glucose more than 500. So their style is different. I have to manage differently. And most come with a subacute kind of a thing, a little bit of this, a little bit of that. Therefore, I do not have the luxury, none of us has the luxury to have a single mindset that diabetes is acute or chronic. So instead of mindset, this English word tells us that your mind is set in one particular mold. Please understand the word mind style. Now, see, style. Suddenly, you feel like this river that is flowing, right? It can be the Ganges, it can be the Nile, but the river has a life of its own. It keeps on flowing. Whenever a bend comes, whenever a turn comes, the river also turns. Sometimes it is fast, sometimes it is slow. And I am reminded of this film song by Yesudas, a singer from Kerala, India, who sings about the Tista Nadi. The Tista river is in Sikkim. And he says, "Tu aisi manchali jaisi Tista." So he talks to the girl, he's singing, and he says, "You are as naughty as the Tista river." Our patients are naughty, and diabetes is also naughty. So keep a mind style which is flexible. Communicate with the patient, understand the patient's concerns and complaints, and then flow with the patient. Once we learn this, flowing with the patient instead of flowing against the patient, working against the patient, this mind style is guaranteed to keep you very happy and very successful in diabetes practice. It is also guaranteed to keep your patients happy and well controlled in diabetes practice. So, this change takes time. But now that you've understood these words, from tomorrow it will be a cakewalk. Today we have spoken about diabetes practice in 5 minutes. Over the next 3 weeks, we will have very interesting topics. Next week, we'll be talking about creating happiness in the diabetes clinic. How do you have a happy clinic? How do you make your patients happy? And equally important, how do you make yourself happy? The week after that, we'll talk about how to create an illusion of time. You have only 5 minutes in the OPD, but how do you expand? How do you make the patient feel that you've spent an eternity with him or her? We'll talk about this in more detail, but in 5 minutes, in 5 seconds, allow me to give 5 principles of creating an illusion of time. Number one, expand the time frame. Number two, expand the interviewing team. Let your receptionist, your physician assistant also help you with taking a history. Expand the reference. Talk not only about the past, the present, but also about the future. Expand the definition of health. Include well being, happiness, psychological health, social health, spiritual health in what you're talking about. And see how you yourself get enriched and how your patient gets enriched. And expand the interviewee team. Speak not only with your patient, but also with whoever is accompanying him or her, the grandchild, the spouse, the brother or sister, the friend. Involve them also in diabetes care. Touch all senses of the patient. And in 5 minutes, you can actually create a window of opportunity. And this window will help us. It will help us manage diabetes. It will help us create a sense of achievement, satisfaction for us. With this, I note now that we've spent 25 minutes talking about a 5 minute consultation. And warm welcome to Dr. Manu Sharma from New Delhi, who has logged in. So it's been great speaking with everybody. I also welcome Dr. Abid Rahman from Somaliland and Dr. Sunit Verma from Panchkula, who are logged in today. Thanks for being with us. And I'll hand over now to Mr. Basu from FDC. Mr. Basu is an experienced healthcare professional who has traveled the entire length and breadth of our country. Mr. Basu, what challenges do you feel doctors face? They are all overworked in most parts of India. So, any best practices you would like to share? How is it that doctors are able to make the most out of the 5 minutes that they get with their patient?
So I think, sir, you have already shared the wisdom of 2.5 years of being one of the top endocrinologists of India and sharing, how to overcome with the patient load India already having. I have also already seen that when we go and meet doctors like you, there is a heavy OPD, and especially when you come to smaller towns. I mean, I can compare it with metro town doctors where there is appointment systems, as you have discussed with the European and American system. But when it comes to a town like yours or a smaller towns in Bihar or Uttar Pradesh, and an endocrinologist having a patient OPD of 200, then obviously the tips which you have given are the best suited tips for today's lecture, as well as which needs to be carried out in daily practices. I mean, token system works at the same time. If you can divide the work into compartments and making the patient travel through compartment A to compartment B to compartment C, and by the time he reaches to the lead doctor, he is feeling that he has spent almost a day. Probably that has been usually been practiced in India, sir. If you have anything add to onto this, sir.
I know. Thank you. And Rajni ji has also joined us. Thank you, Dr. Rajni, for being with us. Uh, these are things actually come with time. But I would just like to reinforce you are doing your best. Let's just make it better and understand the concept of mind style. Understand the concept of giving priority to what your patient is saying. So listen to what he or she is saying. They will give you the diagnosis and they will also give you the mode of treatment. So once you've got that, you can move ahead.
Right, sir. With this, I thank Dr. Sanjay Kanra with us again on a wonderful day. Especially today is Makar Sankranti, and we have already wished all our viewers happy Makar Sankranti. And the lecture series, which is coming next week onwards, will be very interesting and soft tips for improving your practice and how you continue to have a happy practice with your patients around. With this, I thank Dr. Sanjay Kalra. Thank you, sir, and Jai Hind.
Jai Hind.
Jai Hind, sir.